Hi, my name is Malving and I am from St. Paul, Minnesota. I was diagnosed with CF when I was a little kid, and I am currently 34 years old.
Hi, my name is Hyson Chung. I'm 44 years old. I was born and raised in Hawaii, but I currently live in the beautiful hill country of South Central Texas, and I do have CF.
My name is Isabel Yuriko Stenzo Burns. I have cystic fibrosis. I'm 49 years old and I have had a double lung transplant for 17 years. My mother is from Japan and my father is from Germany.
I come from a family of 14. So of the 14, 5 of us had it. However, we were all not diagnosed at the same time.
My diagnosis was rather different. I was diagnosed with cystic fibrosis at age 34 while on active duty in the Marine Corps. I was trying and failing to have kids at the time, and diagnosing that issue is what led to discovering CF.
I was born with my dear late identical twin sister, Anna. And when Anna was born, her belly looked like a watermelon. It just grew and grew, and she had meconium ileus. And so immediately the doctors suspected cystic fibrosis because this was a kind of hallmark symptom of CF. So about 3 days of age, we were given a sweat test and it did come back positive. And the doctors were clearly uncertain that this would be CF because my mom is from Japan and it's extremely rare in Asian people.
It was pretty shocking, but it actually explained a lot of the health issues that I'd had throughout my life. As a kid, I was really small and underweight. When I was age 10, I didn't even weigh 50 pounds. I was really tiny. I had a very small appetite, had lots of digestive issues with what I did eat. I had recurring bouts of sinus infections, bronchitis and pneumonia. Even more recently, I had pneumonia actually in Marine Corps boot camp.
Around the age of 4 or 5, I was diagnosed with cystic fibrosis. Prior to that, I remember going into the hospital, also to a lot of doctor's visits, and I do remember, coughing up mucus or just feeling short of breath. But I just thought it was normal because that's what I remember sort of growing up with. And I know at that time, prior to being diagnosed with CF, I was actually diagnosed with ciliary dyskinesia.
Over the years, I kind of found ways of self-treatment that helped me to get by, taking long hot showers that would help me to clear out my sinuses and clear out my chest. I found as a young adult that I really enjoyed running. And that's actually what helped keep me in my lungs in good enough shape that I managed to get into the Marine Corps with undiagnosed CF. I also discovered growing up in Hawaii, going to the beach, being in the salt air, just everything about my childhood kind of staved off, I think, the worst of it.
All the treatments they were putting me through with my parents at that time, it wasn't working. And so our pediatrician, she knew someone, a pulmonologist at the U of M, and she referred me there to the specialist to just get tested in case that I might have CF, but they didn't think that was the case, being that I was Asian.
The emotional challenges are trying to befriend my body that has constantly interrupted and interfered with the things that I wish I could do or want to do. As a child, CF was a major influence in my family. The time commitment of treatments was extensive. The need for access to medical care was extremely important for my father's employment. In fact, it actually influenced my mom to become a respiratory therapist and then later a pediatric social worker. So CF was obviously not just something that affected my sister and I, but affected my entire family.
I underwent the testings and they came back positive for CF. And at that time, I was about 4 or 5 years old. And I think it was a huge relief for my parents because then they were able to get me on the right medications to really help me out.
Being a male with CF and dealing with CF-related infertility issues. It has been very challenging and has taken quite an emotional toll. I was, I don't know, a little strange as a kid or teenager. I actually knew that I wanted to be a father from a pretty young age. And so it was pretty devastating to find out that I couldn't do that normally. So my wife and I have been doing IVF, and we've had several attempts, and none of them have been successful yet. And so that's always an emotional roller coaster riding that.
They were not able to refer my parents or myself to any support groups for, like, Asians who may be diagnosed with CF in Minnesota or in the Twin Cities, because it was so rare. And then it was even more rare that the family of, my family, out of 14 of us, 2 of us were diagnosed. And then we did have late diagnoses in our family as well for my 3 other siblings. So unfortunately, my parents did not have that support group with them after we were diagnosed and grown up with CF.
When I was 11 years old, I started to go to Cystic Fibrosis summer camp back when they were open. And at that time, I was the only Asian person with my sister. There were just a handful of other people of Latinx origin.
I did have a friend who went to college that had a classmate who had CF. He passed away in his early 20s.
And then finally one year I met a girl who was half Korean. And it was really awesome to see that there was one more person who was like me, half Asian and half white. So she was younger and we became friends. Unfortunately, she passed away very young. She was about 13 when she died. And then I never met anyone else. So it was just Anna and me and my wonderful CF community. I always felt welcome. I always felt embraced and loved and appreciated, but just a little bit different.
I haven't met many others in the East Asian community that have CF. I think actually Isa and Anna are the only ones that I've met. I met them during a CF conference in Hawaii where I was stationed at the time in the military. And then we also attended Great Strides together that week.
I definitely feel that there's a bias in the medical setting that cystic fibrosis is a white person's disease. When I was younger and in the hospital, I was probably approached at least 2 times by doctors that said, you can't have CF, you aren't white.
I was having symptoms. I forget exactly, but I went into the emergency room and I needed I called the doctor and they said, go into the ER. And when I went in there, I had mentioned, by the way, I have cystic fibrosis. This is my care team. This is the information. And the care provider was like, no, you don't. You have asthma. And I was stunned and I corrected her and I said, no, I have cystic fibrosis. And she goes, no, you don't. You have asthma. And I was like, wait, why am I arguing with you? I know I have CF,
I do believe that it's important for healthcare providers to recognize that CF does come in all different colors and that it just is exceptionally rare in some ethnicities, especially the Asian community. And that this disease, scientifically was passed down in different ethnicities for a reason. It seemed to help us perhaps with cholera or other diarrheal diseases. So it exists in every population. So I do hope that healthcare providers are trained to be more sensitive or at least more aware that CF appears in all people across the human rainbow.
But I think there is definitely still some lack of either education or knowledge among some providers, because they are taught a certain way that it's more of the European descent, and they don't realize that others can have it as well. And so their approach may be a bit, I don't know if I'll say ignorant, but they're not very open-minded to some of the patients, like even myself in the past when I've experienced that.
There is definitely a high likelihood that there are people in the East Asian community that aren't diagnosed due to the perception that it's primarily a European disease. I wouldn't say necessarily that my own late diagnosis was entirely due to being Asian. It was probably more related to the fact that I grew up in a small family business in Hawaii, and we couldn't afford health insurance, so I rarely saw a doctor. My mom kind of relied on having a healthy diet, healthy habits and lifestyle, and used naturopathic remedies to keep us well. Since I'm half Chinese and I'm half Caucasian, my family probably would have considered CF as a potential cause for a lot of the things I was experiencing at the time, if we had known about it.
Now, looking back, I look at my parents and I do feel for them. They went with whatever the doctor recommended every single time. Never having met anyone who had CF or knowing any parents with CF. And not only that, being among our culture, I mean, it was almost sort of ashamed to have, someone like myself in the community, because that would be it was sort of looked down upon.
I think the East Asian population is often the forgotten minority in the United States, and that can be even more emphasized in the CF community because it is so incredibly rare. And so I think and we also have cultural issues, cultural issues around shame and stigma about illness, particularly genetic diseases. So perhaps some cultural practices may not be forward with the symptoms. Let's face it, the symptoms of cystic fibrosis are not easy to report without some kind of shame and embarrassment. So I think it's important in particular for healthcare providers and the CF community to welcome and elicit the involvement and encourage the advocacy for the East Asian community.
What seems likely to me is that the relatively lower percentage of residents in Hawaii that are of European descent contributes to the lack of awareness of the disease in the state's medical profession as a whole. For example, there's only one accredited CF care center in Hawaii, and it's at the military hospital that most Hawaii residents can't access. And in fact, after I left the military, I had to seek care from a pediatric pulmonologist who was at the time one of only 2 specialists on the island who treated CF patients. The other guy was retiring and wasn't taking new referrals. So it's definitely not well known in Hawaii, and I would say probably due to the fact that percentage-wise, it's a much smaller percentage of those that are of European descent.
Every ethnic group has their own cultural practices, and I think one of the hardest experiences that my mother had as a Japanese person was to be blamed for having children with CF who are not doing well. My mother happened to grow up in a country where rice and fish and vegetables were the main staples, a very low-fat diet, low-calorie diet, and a healthy diet. But when we were younger and we were malnourished, the dietitian, the nurses, the doctors all blamed my mom and told her, "You're not feeding them enough." And I think it's really important for healthcare providers to be sensitive that where we come from and our practices, our cultural habits and rituals and foods are part of who we are. And so maybe we need to learn aspects of Western nutrition to help us gain weight, but it's important to be sensitive to families with different backgrounds in terms of helping them maximize the care for themselves or their children without blame or shame.
I think the thing, that really helped us to be diagnosed, even though for me it was a little bit later, was finding the right doctor and working with that doctor and really sharing the symptoms, in regards to advocating, working with a doctor to say, it's rare. Yes, it's rare, but at least they'll test out for it and see if it can happen. Sometimes doctors can be quick to dismiss it, or medical providers. And I'm not saying, that they don't know what they're doing. They absolutely do, but sometimes they can overlook cases and situations.
First off, you have to know how to identify the symptoms of CF. There's two really good sites. That's cff.org and then your own cfri.org. There's also other sites to learn more about the symptoms. And if you suspect that you or a family member has cystic fibrosis, go to your doctor and request a sweat test. That's the easiest thing to do. Explain your symptoms, try to rule out other possible causes with your doctor's help, but still be insistent on the testing part. Don't let them say that it's, it couldn't possibly be that. Be insistent, get the test done.
For parents who have symptoms or have children that have symptoms, if you have an inkling or you're just not sure about it, find the right doctor and talk to them and have them help you navigate through it, or reach out, to a support group or a resource out there.
I think it's really important for us to read our own bodies and be our own advocate for our physical needs. And so if someone is having symptoms that are unusual and persistent and even long-term, it's important to do a little research and see what this cluster of symptoms could be. And when you find that these symptoms might match cystic fibrosis, it's important not to rule it out. Just because most patients with CF are Caucasian doesn't mean you can't have CF because you're a person of color. So I think it's important to be informed, to be assertive, to be proactive in your own healthcare needs. The earlier the diagnosis, the better the treatment, the better the quality of life. I'm a huge advocate of that.
After my own diagnosis, my mother also had genetic testing performed so that we could identify which of the two genes that cause my CF is the one that she carries as well. Just because even though she doesn't have CF, it seems to me that it's always better to have more self-knowledge than less. And even if, your sweat test comes back negative, at least and you can pursue other avenues, other possibilities that could be causing those symptoms.
I wish, again, we had those information when we were younger, but we didn't. However, now that I do know that, I want to share that with everyone out there, because oftentimes we just take a doctor's at their word or the medical provider at their word and say, okay, well, this is it. There's nothing they can do. And then, maybe it could be something that they could do or something different, and you just never know. So we really, truly believe in getting a second opinion and having it be with somebody who's completely different from a different provider or anything like that, and seeing if they can test you if your doctor's not willing to.
The answers that I found realizing that I have CF after my diagnosis was so eye-opening. It helped me put all those different puzzle pieces together, and things started to make sense. And so I think there's probably a lot of other Asians out there that have these issues and don't know how to put those puzzle pieces together yet. And by raising the awareness of CF in those communities, they can get diagnosed and they can start getting some explanations as well, and have better ways to treat their health issues, like I found.
I feel it's important to raise awareness about CF in the Asian community because it happens. Oftentimes people think it's not true, or that maybe it's not real, or it's something that's made up, but it's not. I think that oftentimes it gets overlooked for the simple fact that it's a European disease or diagnosis, and it's so rare in the Asian community.
I'm a firm believer in empowering people to make the best decisions for themselves as possible, and I think health decisions are some of the most important decisions that we have in our lives, but we often overlook those. You can't be a passive participant in your health. You have to take control of it. Everyone has their own health issues, whether you have CF or something else. Everyone's got their issues. So especially in this pandemic that we're currently in, you need to seek answers from doctors and healthcare professionals that you trust and use their advice to live the best life you can.
I am very fortunate that my German father passed down a delta F508 gene, and so I could benefit from Trikafta if I wasn't transplanted. But my mother's gene is very unusual. It's extraordinarily rare. So I know I represent a number of people with cystic fibrosis who do not have access to modifier drugs yet. And I hope that CF research and CF fundraising can continue to be strong and robust in order to raise money to find the modifiers that will help all people with CF, not just the majority, because these are the people that sometimes even struggle the most with access, with late diagnosis, with socioeconomic challenges. So they need to have the hope. It is so important for us as people with CF to have hope that someone out there has our back and is fighting for our genes and our mutations so that we can live the best life we can live.